So we are continuing with acute glomerulonephritis. And in the last video, we saw the definition, we saw the causes, we saw the signs and symptoms. And in this now actual video, we are coming now to talk about the investigation, how to manage the condition, prevention, and complication. Here we go. What are those investigations that we are going to do if someone is suspected to be having glomerulonephritis? After we have said glomerulonephritis is an inflammatory condition of the glomerulus, some of the investigations are, we shall take off a urine sample. And this urine sample, we want to test the proteins, we want to take it for microscopy so that we can look at the pus cells, red blood cells. So we shall take off a urine sample. Then we shall also take off a blood sample, and this one is to test the urea and creatinine, and sometimes also the electrolytes level. We shall also do an ultrasound scan of the kidney, and this one will show us the size, shape of the kidney, because in most cases, if someone has glomerulonephritis, the whole kidney is inflamed. So we are going to do an ultrasound scan, and to show us the size and shape of the kidney, whether it is in the normal shape or there is a change. Then since we talked of the cardinal sign, one of them being hypertension, so we are going to do blood pressure so that we can see is there increased blood pressure or it is still normal. Then also we shall do a throat and skin swab where indicated. We say this throat and skin swab, we are taking it for culture and sensitivity. Most people who suffer glomerulonephritis, they always possess with sore throat. So, and this may have suffered an upper respiratory tract infection and was left untreated, and the microorganism, especially the streptococci, gained access into blood and now went to destroy the glomerulus. Those are the investigations that we can do to identify if someone has glomerulonephritis. Now, how do we manage this person with glomerulonephritis? We are saying the disease is usually self-limiting, and the majority of patients may recover spontaneously. In other words, there is no clear treatment or management of this person's glomerulonephritis. Most of the class who gets glomerulonephritis just heals spontaneously. But there are some measures that we can be doing to help this person recover. One of them is rest. So the patient should be nursed in a complete bed rest in a warm, well-ventilated room, and we should ensure ambulation. A short distance must be restricted until the kidneys have had time to heal, and there is little or no protein in blood or urine. We should allow this patient to rest. Resting gives ample time to repair worn out tissues. So we shall allow this person to rest so that the body can get time to repair the damaged kidney. Next, we shall talk about dietary regulation. So we are going to design a dietary regimen. What do we do? Proteins should be restricted in the diet. This is a must. Once you notice a person has glomerulonephritis, proteins must be restricted. Adequate calories should come then from carbohydrates and fats, while ensuring that there is minimum protein breakdown. So what should be the range of protein someone should take daily? We are saying if a colleague has glomerulonephritis, an average protein should be with 20 to 40 grams of protein daily. This is adequate. The diet should be more full of carbohydrates and fats rather than proteins. What about the fluids? You are saying we are going to replace the fluids that are being lost. But also remember there's hypertension. So what do we do to the fluids and electrolytes? We are going to assess the patient frequently for signs of fluid overload. Once there's fluid overload, we are going to ensure that there is an issue of daily weighing. Because of the fluid overload, you are going to notice we're going to give some diuretics. In addition to that, daily weighing of the patient. Because of irritation of fluids, most patients increase in weight. So fluids must be restricted to 1,500 mils in 24 hours when edema and oliguria is present. If a person has edema and still has oliguria, and you are to give intravenous fluids or oral fluids, we should not exceed 1,500 mils. An intake and output chart, which we always call a fluid balance chart, should be instituted to monitor the input and output. Otherwise, we are going to cause more edema in this person. This is a bit tricky. We are working on a patient who has hypertension, but still has oliguria. So once we have given fluids not exceeding 1,500 mils, still have to monitor the fluid balance chart. Then we talk about the food in the management, and we are saying food should be in such a quantity as the patient desires. There is no minimum, there is no maximum. But the ideal is proteins should be low, 20 to 40 grams. Food should mainly consist of carbohydrates and fats strictly. And once we do this, the person is going to have ample time to recover. Then what about the salt? We are saying should not be used in cooking. When someone has glomerulonephritis, salt should not be used in cooking. In other words, the person who has glomerulonephritis should not take food with salt. The food should be salt-free. If edema is severe, no salt diet should be given. And that's why we are saying food should not have salt, because it is going to increase the edema. That's the extravasation of fluids. It's going to increase on the irritation. And that's why we're trying to restrict it in this person with glomerulonephritis. Avoid or use with caution any drug excreted by the kidney. We are saying if you are giving other drugs to manage the patient, but those we know that they're excreted by the kidney, we should almost avoid or stop giving them. Some chemotherapy that you can be giving the person who has glomerulonephritis, remember you're talking about management, treat any continuing hypertension. Remember we say it's one of the cardinal signs. Most people with glomerulonephritis have hypertension. You can administer captopril to 25 milligrams OD daily. You can even add some calcium channel blockers like nifedipine to manage hypertension. Then you can also use diuretics, and these ones will help reduce blood volume and edema. The commonly used is Lasix, which we also call furosemide. So next, you are going to treat now the primary staphylococcal infection. We are going to give antibiotics. Penicillins are the best. You can give amoxicillin, but if someone is having allergy or in pregnancy, you can give erythromycin. We can also give prophylactic treatment, penicillin every month, or erythromycin in case of allergy to penicillin. So it's a bacterial disease, and those are some of the antibiotics that we are going to use. If someone suffers glomerulonephritis, is the prognosis good? We are saying no. The prognosis is always poor with acute glomerulonephritis than in nephritic syndrome. Nephritic syndrome, here we are having the nephrons affected. But when you have glomerulonephritis, the nephron is affected and also the glomerulus is affected. How do we prevent this condition? One, energetic treatment of throat and skin infection. When someone gets upper respiratory tract infection or skin infection, we should not neglect them. We should treat them because that's where the source of the problem starts. Avoid overcrowding. Then lastly, we are saying adequate ventilation. The condition is related to airborne diseases, in that with overcrowding and lack of adequate ventilation, the people are having those upper respiratory tract infection, which you will suffer and you fail to manage, and hence they may end up leading to glomerulonephritis. Complications: if someone is left untreated, what happens? One, congestive cardiac failure, renal failure, nephritic syndrome, hypertensive encephalopathy, heart failure, and pulmonary edema. Something to note: the patient may have both nephritic syndrome and acute glomerulonephritis, and in this case, we call it nephritic nephritis, and the prognosis is poor. Thank you for listening. Share this video with your friends in everywhere, especially the medics, so that they can get more information about glomerulonephritis, how to manage it, the possible complication. Thank you so much.